So if you are curious, or if you are a healthcare assistant, wanted to do the apprenticeship, or you want to join a hospital, this video is for you. I'm gonna take you through the day-to-day, especially when you are working early shifts or late shifts. I'm gonna focus on early and late shifts or long day shifts. That is what I have been doing for the last couple of years. So my name is Leslie Vasquez, and I'm here to share practical tools of how you can communicate effectively with your patients or with your colleagues when English is your second language. So on the screen, I think you have the tasks that have been listed. I'm going to be talking through them, but if for you it's easy to read, just read them there. Task of a nursing associate trainee vary depending of the ward you are working in. In this one, I'm going to focus on the physical health works in either acute or also rehabilitation wards. So it's really important for you to know that when you are doing your apprenticeship as a nursing associate, you are allowed to have some supernumerary time, and this time means that you are going to have allocated time to shadow a nurse or a registered member of the team, where you are going to learn different things. You are going to support medication administration, you are going to practice new clinical skills. This needs to be always supervised by the registered member of the team, registered nurse or physiotherapy or whoever is available. So you can check here how to do catheter care, wound care, venipuncture, oxygen therapy, sometimes PEG, parental feeding, but always you need to be with someone around that is going to show you this. And also in your supernumerary time, you are going to have time to write reflections, which is a big thing when you are studying and also post-studies, because once you are qualified, you need to revalidate in order to have your PIN number. And for that, you need to write reflections on learning experiences, but also good things or challenging things that you have seen at work. So it's really important that you ask your manager or your supervisor to give you this supernumerary time, and your roster is a government requirement, and you are allowed to have that apart from your normal hours of duty. Task when you are on the floor. So by this, what I mean is that sometimes when we are working and you hear other people talking in the ward, they say, they are counting the numbers, they are counting on the floor. So it means that you actually, if you are on the floor, you are going to behave as a healthcare assistant. Even though you are a trainee, you need to remember that when you are the apprenticeship, when you are doing the apprenticeship, you are getting paid for it. So obviously you are part of the team, and you are counted in the numbers. So on an early shift, you will start around 7:30 to 2 p.m. in some hospitals. Others hospital finishes at 3:30. Or if you are going to do a long day, you're going to start at 7:30 in the morning and finish it at 8 in the evening. Some people prefer to do that because they can meet the hours quicker rather than having to go to the hospital every day. So the first thing to do in the morning is that you are going to have the handover from the night shift, and you might get assigned between 4 and 5 patients. And sometimes you might be allocated a student to work with yourself as well, so it's going to be part of the team. It might make things a little bit easier in case you have patients that need two people to be transferred or to be mobilized. So one of the things after you have taken the handover, so I'm thinking about 7:45 in the morning, 8, you are going to get patients ready for breakfast. But saying this, what I mean is that you're gonna help them to sit them up properly. You are going to give them things like their dentures, like glasses, or whatever they need to eat in order to eat comfortable. It's really important that you check the pink chips. There are some words that on the wall you will see this pink chip saying what type of allergies the patient have, which type of food the patient can eat. Some people can eat like moisture food or liquid food. They have different levels. You will understand what you see there. So you make sure that you always check that when you are giving a patient something to eat or to drink, because also for drinking, sometimes patients might need something to make the liquid a little bit easier to digest. So just make sure you check that pink chip. Then if the breakfast is ready in your bay, you need to make sure patients are eating the breakfast, and some people might need physical assistance. So it means that you need to feed them for them because they can't do it themselves. So, make sure people is always having something to eat at breakfast time. Please do not leave the ward when patients are having breakfast, because some of them might be at risk of choking. So you always need to be around in case something like this happens. So always be around, checking that they are fine, they're eating okay. And once they finish, you need to record the food and the fluid intake in the care and comfort bundle. This is the sheet that you're gonna see for each patient. It's really important for you to know that nutrition is critical for patients in their recovery. So if we want our patients to get better quicker, we need to make sure they eat and drink properly. So, nutrition is really important, and you must record and be specific of what type of food they have eaten, how much food they have eaten, half of the food, quarter, all of it, and same for the fluids. Tea, orange juice, apple juice, coffee, water, whatever. So always make sure you record that. When breakfast is ready, the next thing you're gonna be doing, we're talking about 9 in the morning, we're gonna start getting patients ready for the day. By that I mean after breakfast, you will need to help patients to get probably ready, like with personal care. So washing, dressing, toileting, and sometimes probably giving them more fluids if they need to eat more, drink more. Then you need to support with mobility and transfers, and you need to do this safely. So some patients might be independent and they can do it by themselves, and all you need to do is supervise. So sometimes you might see something called SO1, which I'm gonna write here, SO1, and this means supervision of one. So you need to be there supervising this patient. Or sometimes patients might need to be assisted of one. So you might see something like AO1, which means that you need to physically be there for the patient and help them maybe to put the clothes on, socks, apply some things, into creams they might need, or oral care, whatever they need. You physically, when it's assistant of one, you need to physically help that patient to get ready for the day. And always watch out for patients that are assistant of two, because for you to complete this task, you might need someone else. So you might need a registered nurse, a physiotherapy, or occupational therapist, someone that is around and have the training for you to be able to mobilize that patient or to transfer that patient safely to the chair, out of bed, use the equipment is available for the patient to get mobile. When you are doing that, also when you are getting patients ready for the day, also make sure that you respect their choices. So ask them if they want to wear, which type of clothes they want to wear. Sometimes the clothes aren't very comfortable for the therapy or for the rehab session, but if the patient wants them, it's their choice and you need to respect that. Please avoid to have pajamas in the daytime. That's something I personally don't like. I understand it might be easy for some of our colleagues, for some patients, but some patients prefer to wear their own clothes. So just make sure you check with the patient before you put something on them. Again, there are patients that might not be able to do their oral care independently or apply any barrier creams in their legs. So make sure that you apply that cream and then you do oral care so they can enjoy food easier and the skin can be intact at all times. This is really important. Encourage patients to sit out of bed. I know some patients prefer to be in bed all day, but this is not good for their recovery, and also they can develop things like chest infections, constipation, pressure sores. So, once the patients are ready, and if you are able to do so, please encourage them to sit out of the bed, maybe sit in the chair, maybe, different position. It will help them in the long term. So please always encourage that. And then once you finish getting patients ready for the day, remember to record what you have done in the care and comfort bundle. Again, you're going to see that in the patient's note by the side of the patient. And then you will need to record things like the skin condition. So when you are helping the patients to get ready or supervising them, make sure you check the skin's pressure areas, elbow, back of the head, buttocks, heels, spine, hips, all these areas of the body that are at high risk of become pressured. And then bowel and bladder movement. So if the patient has open bowels or has passed urine, always remember to record that as well. And the pain score, try to ask the patient if they are in pain, because then the registered nurse is able to provide some medication for these patients that are in discomfort because of pain. So, make sure you always record all that information in the care and comfort bundle, and doing as you finish, because sometimes we forget, you get so busy. I'm talking about here getting patients ready, I'm talking about 4 patients, and you get busy and you forget, and then by the end of the day you are like, what has happened with this patient? Nobody knows. So make sure you always record that once you finish your task. Then if you are lucky, you might have your morning break. So you can have, sometimes in some places they might give you 15 minutes for you to go to the toilet, for you to have a drink. But if you don't have these 15 minutes, I always recommend to stay hydrated. Just make sure you have your bottle of water, or a drink or something. I always carry in my pocket this shot of, I don't know if you can see, is collagen, which is really handy to have in the pocket and just to drink it, and it kind of gives you a little bit of energy. But whatever, if you have a snack or just water, just keep drinking water, because it's really important to be hydrated if you really want to provide quality of care for your patients. And also, before you go for your break, if you are allowed to go for your break, make sure you inform the nurse in the bay that you are going to go for your break, so someone is always around looking after the patients. That's really, really important. Then, once you finish your break, it might be time for lunchtime for patients, not for you. Sorry, not yet. So to start with the lunch, some patients might need to use the toilet before lunch. So you need to assist them with that, taking them to the toilet, maybe passing a commode, maybe bedpan, maybe check, if they are incontinent, you might need to check that, how is that pad going there. So you need to change the pad just to make them comfortable before they sit for lunch. And also repositioning in case they are at high risk of pressure sore. Some wards serve their lunch in the day room, so you need to physically transport those patients to the day room so they can meet up with other patients and with more members of the team, and it kind of makes it nicer just to have lunch in a different place, not just in the bay. So you might want to do that. Or some patients prefer to stay in the bay. Is their choice at the end of the day. We encourage them to move around, to go, to walk, to do anything. But if the patient refuses to do that, just keep them in the bay, but make sure they are comfortable, make sure there is someone always around, keeping an eye on them, and they have all they need to eat properly. Again, remember, check the pink sheets before you start giving any food for the allergies and for the dietary, that word is really difficult, requirements. Make sure to minimize the instructions and encourage independent eating. So, like you say to the patient, can I pass you a fork? Is it easier with a spoon? Is it easier with this type of a spoon? There are lots of equipment that the patients can use for them to eat, to feed themselves. And it's really important to encourage that. And again, just be aware of any choking hazard. Sit the patients up right. They check that the food is okay for them to eat. And once they finish the food, record all this information again in the chart, in the care and comfort bundle, and be specific. How much have they eaten? What have they eaten? What have they drunk? The amount of fluid they have taken. This is really important for them, for their recovery. Remember, nutrition is key. And then once the patient have eaten their lunch, they finish their lunch, you can check with your nurses if it's okay for you to go to your break. So you're gonna get around 30 minutes break for lunchtime, but there must be someone around with patients when you are for your break. So just make sure you inform the patient, make sure you inform the nurse before you go anywhere. Once you come back from your break, probably the nurse need to go for her break as well, or his break, so you need to be around, and then you start kind of planning your notes and documentation and other tasks. For some people, it's easy to start writing their notes, the chief care notes around 2 p.m. when the late chief had already started. They start at 12, so you have time from 12 to 2 to start writing your notes. But if you are doing a long day, you might want to start writing your notes a little bit earlier and then finishing in the evening time just after dinner. You need to plan how you're gonna do your notes and make sure you discuss this with your nurse, so you work as a team basically. Ensure that all the documentation in the care and comfort bundle is accurate and up to date. Go through it. You need to check reposition, skin condition, bowel and bladder movement. All this information needs to be physically recorded in the care and comfort bundle. And if you have time and energy, do some e-learning if you need to complete any of your e-learning. Now the late shift starts at 12 and finishes at 8 in the evening, and then again, as in the morning, you're gonna take the handover, and in the afternoon you might get assigned more patients because there is less to do in terms of patient personal hygiene or personal care, but maybe other things need to be done. So anyway, you're gonna have more patients in the afternoon, so sometimes about 5 to 6 patients. Once you finish the handover, you need to start support ongoing tasks in the ward, to maybe assist with lunch in case there is a need of someone to be around with patients, feeding patients physically, making sure that all patients are eating, and then you can make sure that all patients are eating and drinking. And when they finish lunch in the afternoon, some of the patients might have a sitting tolerance chart. It means that they have so many hours to be sitting on the chair, and where they are allowed to be sitting on the chair because they get tired. So you need to check that and help them to go back to bed after their meal, so they can have a little bit of a rest. Again, if someone is assisting with feeding, just help them feeding. If you have time, you can help the coordinator to take some samples, do things like blood tests, urine samples, taking patients for x-rays, taking swabs to send to the lab. All these kind of clinical procedures that sometimes they are left for the afternoon shift, so you can support that. And if there is an admission going on or a discharge going on, or to move beds, you can also support the ward in those tasks that need to be done, that in the morning is nearly an impossible mission to do because it's so busy in the morning, but in the afternoon sometimes we have more time to do those things. So if you come for your late shift, please just offer some help to do that. Then once you finish all this, it might be time for QDS care, and this is a time toileting. This is a routine that some of the patients need to follow in order for them to prepare to get discharged. You will have the chart in each bay, and it's not for everybody, it's not for all these patients, it's for specific patients, so you need to check the notes, and in the handover they will let you know who is in QDS care. So if those patients need QDS care, please do help them or assist them. Again, you're gonna support them with personal hygiene, transfer, repositioning, and then you have more time to engage with patients, and just to check how they are in terms of mental well-being. Sometimes people might get depressed, might get a bit anxious, might get a bit lonely. So it's good for you to kind of engage with those patients, ask questions if they can communicate verbally. If not, just make sure you are aware of what's going on in their mind. And then, pass on to the nurse and record that in your notes. Again, in the afternoon, you must record in the care and comfort bundle skin condition, bowel and bladder activity, pain score, and repositioning. You need to do this every time you see a patient and you do something to a patient. Once you finish your QDS care, it's time to do observations. Again, this is another task that you do in the afternoon, the late shift, and by this I mean you will start taking vital signs like blood pressure, temperature, pulse. You're gonna check the respiration and the oxygen saturation. For this, you might need training, and some places don't provide training. You kind of have to watch some on e-learning, and then you learn by that, or just ask the nurse to tell you. But if you are not comfortable doing it, just ask the nurse and tell the nurse, I haven't done this before, I haven't got trained, I'm not happy to do it. But it's quite interesting. I find that quite interesting because this is more a clinical task type of thing, and then you will learn a lot from it. Like, for example, for blood pressure, if the blood pressure drops, you need to maybe encourage drinking a little bit more water or any more fluids for the patient so the blood pressure can go up. And for oxygen levels, for example, if the saturation is quite low, make sure the patient is sitting up properly, is breathing properly, is not that cold. You kind of learn a lot of things from taking observations, and I find that quite interesting. It's time consuming, but it's interesting. You will learn a lot. And then if you see anything that is not right, you need to report those changes immediately to the registered nurse. And then you have another document called the news chart when you need to record all your findings. And make sure, if there is someone triggering, we call this triggering. If someone is triggering, you need to inform the nurse. Actually, I got this given in my training. So this is the chart. This is for the observations. And it tells you the numbers. It's here. So yeah, you're gonna have that for you to record the observations. So after observations, then you're gonna have the dinner. It's gonna be dinner time for patients, not for you. So again, you need to sit patients up properly. In this case, they don't need to go anywhere, so they can have their dinner in their bed or in the chair. And then you need to make sure they are okay, eating, without any risk of choking. And then when they finish dinner, just record that they have eaten and drinking whatever they have has been the intake. Always remember to be around. Do not leave patients by themselves when they are eating at any time. It's really dangerous. Unless the patient is independent and don't have any risk of choking. You ask the patient, your patient is fine, you can go. But if the patient can't communicate with you verbally, physically, you need to be around. Once dinner is finished, it's time for your break in the evening. So then again, you're gonna have 30 minutes break. You can do whatever you want in those 30 minutes. And when you come from your break, it's time to wrap up. So I call this wrap up task because it's nearly time to go home after a really long shift if you have worked a long day. Wrap up task, you need to tidy up and restock the ward. Some bays might have some trolleys where you can put some linen, some equipment that you might need, just for you to be ready in case patient needs something. Towels, pajamas, blankets, pillowcases, all that stuff. Also, sometimes you might be assigned to do the resuscitation trolley. So if you are assigned, you have time to do that in the afternoon when you finish all your other tasks. And then you are going to start writing your notes and check your emails. And some patients around, probably after tea time, around 6:30, 7 in the evening, they might want to start getting ready for the night. So if you have time and you have finished all your notes, you can help those patients to get ready, pajamas, oral care, personal hygiene, all the stuff. But if you don't have time, you can inform the nurse that you don't have time, and they might talk to the patient and say, could you wait a little bit for the night shift to do this task? Because then the night shift will start at 7:30, and then we have more time to get patients ready for the night properly without rush. So this is all I wanted to share about the task of a nursing associate trainee or healthcare assistant. It's basically the same. I hope you like this video. Remember, my name is Leslie Vasquez, and I'm just here to share some tools that can help you to communicate clearly with patients and with your colleagues when English is your second language. If you like this video, please subscribe to the channel and give a like. See you next time. Bye.